Feinblatt here? Oh yeah, she came from, all right, let me go to this lady who's not here yet. Okay, obviously she's been here before in 2023, but every admission is brand new.
Yes.
So we're gonna start and look at the new care plans on her. So I'm gonna go, it's RAI, care planning. And if you go to the templates and add a problem, all of those with an asterisk are mandatory. So they have to be put in, okay? So let's just do ADL function. Okay, I'm gonna select it. Now, I don't think she's a Hoyer, so I'm gonna just take that out. You can put the whole thing in and then edit it if you like, but and if she's a Hoyer transfer, I will add it back in. So this is going to be a long-term goal. The first group are all long-term goals except for COVID, and I'll show you that one. So we're gonna go out 3 months. So 1, 2, 3. So by June 27th, we want her to do this, okay? Resident will be groomed and appropriately dressed. Now, in here, I'm gonna fill in how much assistance she's going to need. So for example, she might need 2, which is limited assist with bed mobility. If maybe she's a hip and you know she's just starting therapy, I'll put 2 to 3 for transfers, okay? And I go through, you do all of them, walk in the room. The only one they're usually a 1 for is eating, unless we have to help them actually feed, okay? So then you just go through, keep
So
finger.
everyone's a 2 assist except for feeding.
Yes, yeah. Unless they need feeding, okay? Then you're gonna go in and just make sure you have somebody that's going to be doing this. Like this is CNA, they're gonna do oral care. And they're either set up and supervise or they're going to actually do it for the resident. So you just go through and make sure that somebody's assigned to every task.
Okay.
This one, we're gonna go out 3 months, 1, 2, 3. There we go. Make sure. Every once in a while you come up with a blank one, so you just have to make sure, because at the end it'll correct you and say, you know, you need to have a discipline assigned for each. Okay, so then I'm going to save that. And I obviously filled it all in, so it will be there. Okay, if she comes in later and I find out she's a Hoyer lift or an extensive assist, you can go in and edit.
Okay.
And change it, okay? So the care plans are not difficult. As I said, the first few COVID, the only thing different with COVID is we're only going to give it a 2-week window. We're not going to put it out for 3 months, okay?
Okay.
Dietary helps fill in the nutrition one, but it's really up to the nurses to put the initial care plans in. And usually what happens is the admitting nurse is supposed to put in all the mandatory ones. And then I or Ricky or somebody will get an audit and we'll go back and we'll put in other things. Like for example, let's see. Resident, we probably don't have her orders yet. No, we don't. Okay, let me look at another resident. Search resident. Let's do Anita Moss. So say if we look at Anita Moss, and then I'm going to look at her orders. We need to make sure that every medication has a care plan, or it's connected to a diagnosis. So for example, Eliquis, there's an anticoagulant template.
Okay.
So let me see if we have that documented here. Okay, well, if we don't have that, here's one with GERD. Okay, so she has a diagnosis of GERD, and then we write in Anita is prescribed pantoprazole. Okay, here's another one, requiring levothyroxine. That way you don't have to write a brand new one for every medication. I just go in and I link it to whatever the diagnosis is. Okay, so here we go. Anita requires Eliquis related to cardiac dysrhythmias and AFib. So it's really not hard. And as I said, the RNs usually start this, but if you happened to be the LVN that takes an order for a new antibiotic, you should be putting in the new antibiotic in here, okay?
So you would go to.
You would go template, add problem,
Okay.
okay, and then I would do it under infection. Well, look at you, I haven't seen you in 100 years.
Hi.
So I would go in infection and view.
Uh-huh.
Resident presents with, say, elevated temp,
Okay.
secondary to UTI, and sometimes I don't even leave the as evidence by in. But then I would add in there, and is taking Cipro,
Okay.
okay? And again, that's a short-term goal, 2 weeks,
Yes.
okay? And then everybody is supposed to go back, but it doesn't always happen. But any person that you're reviewing, if you see something that's already resolved, discontinue it, take
This
it out.
ideally is during the weekly summaries.
Yeah, yeah,
Okay.
when you do your weekly summary. So for example, if Anita had a bruise when she came back from the hospital 3 weeks ago, and you check and the bruise is not there, take that out.
Okay.
Just take the care plan out, resolve it, and be done with it. Because otherwise, they end up having care plans that are 6 miles long, and some of that stuff is not even pertinent anymore, okay? So when you do your weekly summary, if you can do a review of everything, take everything out that's not necessary, okay? Let me go look at, let me show you GG. Okay, this is called GG. It's the Functional Abilities Assessment for Discharge.
Okay.
When someone is admitted into skilled for the first 3 days, on the day and the evening shift, they're supposed to do the GG. Okay, and I'll show you what it looks like. Oh, good. And then 3 days prior to discharge, we do the GG again. So you've done a couple, so you know what they look like.
I did it on Mr. Sigler.
Oh, okay. So again, you just go through and complete it. Because hopefully what we're going to see is they had improvement from their initial to their discharge GG, okay? And it's also, we get paid for Medicare, so these are very, very, very important records,
Okay.
okay?
We were not doing them when I first came here. Is it a new requirement, or like we should have been doing it?
We
all?
probably should have been, well, the GG hasn't been around forever, but it's been a couple years, hasn't it? Yeah, I would say a couple
Yeah,
years.
that makes sense.
When we
then.
introduced Matrix, we didn't do the GG.
Yeah. Let me look at somebody who's taking, I know, taking pain medications.
South Hall.
Simmons, yeah.
Probably a good account.
I was gonna do Deb Simmons, okay.
Oh, that's true.
Your chart, Medicare chart.
That's it,
Oh, this one?
yeah, thank you.
Let's figure it.
Thank you.
I was actually looking for a folder.
No, I'm sorry, I should have been more specific. Okay, so let's look at Deb. Okay. Okay, so here's her pain medication. All right, and give for breakfast, breakthrough pain, not relieved with other pain meds. So let's look and see if she's had it in the past 14 days. Yes, okay. So, what is supposed to happen? Okay, and somebody did do this very well. At 12:02 a.m., the reason was pain. You do the pain scale before you give the medication, okay? You administer the medication, and then an hour later you follow up, and hopefully she's had relief, okay? And it looks like every time she's sleeping, to me that indicates she's had pain relief, okay? And they did put 0. Here she was awake, 2 out of 10, so that was probably acceptable to her, okay? But it's very important that you document the pre and the post-op pain, because we have gotten dinged on that in the past. Not that that's a reason to scare anybody, but it's important that we document.
I need you.